Okay, so you know that you are not dealing with severe, debilitating, crippling depression, but are you a functionally depressed person? What exactly is that, you ask? Well, someone who's dealing with functional depression experiences significant symptoms of depression while also being able to maintain their normal daily activities. Well, that doesn't sound so bad. Why are we discussing this? Well, because if you are dealing with functional depression, then you are living with the silent killer of mental health conditions. Oh, I got your attention, huh? You want to know why I call it the silent killer? That's because behind all of the productivity, the setting goals, meeting goals, accomplishing things, being there for people, being the go-to person, getting everything done for everyone, and being an all-around exceptional person lies your unchecked depression. Well, if you're able to get all that done, why do you need to check your depression? Well, because if you're not checking it, that means that you are accommodating it and making room for it in your life, which means that you are not acknowledging that you have it, you are not treating it, you aren't dealing with the foundational issues that are driving it, such as your hurts, your pains, your traumas, your family dysfunction, the disappointments that you've experienced. And it means that you aren't learning skills, strategies, and techniques in order to manage it. Well, if it's not interfering with your daily life, why do you need to manage it? Well, because what happens when we don't deal with or treat a health condition? It worsens. It becomes more severe. It becomes chronic and untreatable. It can become a life-threatening condition. How do I equate the functional depression symptoms to a life-threatening condition? I'm going to give you 3 reasons. The first one is, as a functionally depressed person, you have the energy to actually attempt suicide. The person with major depression doesn't have the energy to do these things. When they're in their darkest space, they don't have the energy to get out of bed, to shower, to cook, to eat, to parent. So they do not have the energy to plan, gather the means, and implement a suicide. But a functionally depressed person does. Second reason, you have the belief in yourself that you can actually accomplish a suicide.